Hey, Lisa, thank you. And thank you to you and Just in Time Training for being our sponsor of all of the tech today and all the wonderful things you do to make these webinars a reality. And hi, everybody, or I should say, like our friend who just joined from Nevada, howdy. It's good to see you all today. This is our monthly third Friday training that the Survive and Thrive Advocacy Center, excuse me, does. And we do these trainings because we know that it's so important for people to understand the ins and outs of what human trafficking is and also how it is showing up in our community, where we are, whatever we're doing. And I have to say, this is something, these programs, by the way, are things that Stack started before the pandemic, but we took them online during the pandemic. And since then, everybody, we have, thanks to these programs and others, have trained over 22,000 people, if you can believe it. So I can believe it because look at today, we're already at 220 some people who have joined. And it's very gratifying. So thank you to all of you for being here. I know some of you are return. I always like to say frequent flyers, but some of you have been really constant attending these trainings, and I hope you found them helpful. And feel free, by the way, if you have, to put that in the chat. I'd also encourage you, if there's something valuable, which I know you're going to find today is going to be tons of valuable information, to please share them with your, share this program with your colleagues, with your friends, with family, with faith community members you may be associated with, because that's what it's all about. It's all about us sharing, and you do a huge service to this field and also to standing with survivors when you do share information so we all can be smarter and do better. Um, so here's what Stack is. We do this community education, but we also do it. We do direct work, I should say, with all uh, survivors of human trafficking, whether that's sex trafficking or labor trafficking or both, whether it's minors or adults. We do this because it is the only way, I think, for us to authentically be able to do any of these trainings, to be honest with you. If we're not grounded in the work of being one-on-one with survivors on a regular basis, and right now, since our inception 10 years ago, we have worked with over 250 survivors. And we do this with active care management, with helping people with everything from housing to maybe a bus ticket to a safe place out of town, to a new phone, to all kinds of work that makes it possible for people to heal and to get to the next best part of their lives. The only way we do this is with partners, and that's why it's so great in the chat to see all of you. Everyone from, I've recognized a retired judge. Hello, Judge Tepper. Good to see you. To the healthcare profession is here. We see nurses, we see children's advocacy centers, law enforcement. And the only way we do this work, and you know well, is to do it in partnership. One of the things that we do in all of these programs, by the way, is we really try to dispel myths and misinformation that's out there. And that's why we are constantly trying to do better in our community to reach out to our rural areas. Really to combat that myth or to dispel that myth that human trafficking is just something that happens in our big cities or big metro areas. The community education is vital. And then for those of you who are local, especially, know we can come to you with community education that's tailored to your agency. We've come to people from everybody from banks and financial institutions to law enforcement to community groups to schools. And we've done training on this topic. So know that we are here for you. Okay, next slide, please. One of the things you'll find is if you go on our website, and if you haven't already, can you please do us a huge favor? This is a great benefit for you and for us, for you to join our newsletter by going to this website, surviveandthriveadvocacy.org. And when you go under training and educational resources, you're going to see this program in about a week, and you're going to see all of our past webinars. So this is a part two, by the way. I'm sure you've noticed that Katie was here last month. She was here in February and did a part one on trauma. That is posted now, and we will be posting the slides from this program, this webinar, as well by going to our website. And when you go there, of course, you're going to get that annoying little pop-up that says, do you want to join our newsletter? And I just beg you, please do that. So all of our services and support are, of course, free of charge. That doesn't mean we have unlimited grant funding or other kinds of support. What we do is rely on people like you. It's the people who see the value of what Stack is doing and help contribute to making it possible. So these webinars are a true community service that we do, and we greatly value your support. We are 10 years old this year, so last month we turned 10, and we're really looking forward to, I hope, having people become monthly subscribers or donors, if you will, to Stack. Know that this is but one of many things this program that Stack does. So check out our event page if you want to know more. Okay, next slide, please. One of the things that we started a few years ago is this podcast, and I'm a confessed podcast nut or devotee, whatever you want to say, but I love podcasts. And it is one of the best things I've ever done in my professional life is to host these conversations. We speak only with survivors, and I'm very, very happy, proud, gratified to say that our speaker today is on two of those podcasts, because just like when she prepared for the first webinar, we realized there's so much information that Katie has and that we want to share, that we wanted to break it up into part one and part two. And aren't you all happy that we've done that? So if you, one of the things I'll tell you too, you can listen to both of the podcasts, you can watch this webinar, and you will not be hearing repetitive information. You will be hearing maybe reinforcing information in part, but they've been very different. And when Katie comes on, we can talk about that more. But please take advantage of the podcast, and it will help you learn and know more about this topic, and help you in a way that is really the true authentic way to do it, which is to listen to the voices of survivors. Note too that this is not a podcast where we go into the worst things that ever happened to an individual, not at all. What we do on this is talk about what survivors want us to know to be more protective, if you will, of what is going on in a survivor's situation. And by protective, I mean informed and understanding. So, all right, next slide, please. And here's the link if you want to grab that with your cell phones now. If you do want to support our work, we greatly appreciate all that you can do to help us make a difference. And I'll tell you a story. For those of you who get grant funds, you'll know exactly what I'm talking about. But our survivor community services advocate is Graciela Marquina. And Graciela works day in and day out with survivors. And what happened one time is a survivor just needed a $300 car repair. And that was not fundable under federal funding, not fundable in any other grant stream that we had because they're restrictive. But we were able to, because we do receive unrestricted funds, to be able to just pay for a $300 car repair, which meant that this survivor was able to keep her job, was able to finish getting her degree, and was able to continue forward. So believe me, every dollar makes a difference. And I'm glad we're able to do this. Next slide, please. Okay, so Katie Papke. So you can read what is here in terms of Katie Papke as a survivor. I will tell you that she is a highly accredited and professional individual who's a social worker, as you can see, alcohol and drug counselor, advocate, provider. She has years of working in community education and has done, and I was just gobsmacked by this, Katie, that you've provided over 120 national and international trainings on trafficking. You're associated with a group called HEAL, Heal, and if you all don't know about HEAL, please look at it. It is a preeminent resource for the healthcare community on this topic. I'm proud to say Katie graduated from my alma mater, Florida State University here in Tallahassee, with her bachelor's and master's of social work. Um, Katie stays active in this field as she is a therapist and has a private therapy practice. She's also really involved in a lot of local boards, and I'll put a little commercial in there. If you all aren't, and you have a local anti-trafficking board, I really encourage you all to try to be part of it. And this is, Katie, something that I truly admire. You stay active in your local West Michigan Human Trafficking Task Force and in a lot of other programs, working with everyone from DHS and the Blue Campaign to Polaris to HEAL to Freedom Network to the Michigan Abolitionist Project. So I thank you very much for all of that work, because what that means to me too is that as you speak today, you are really bringing in a lot of great information from all over the country, all over the world, and really your own experience, which is completely invaluable to our learning. I want to mention too, our partner is CCYS. STAC is closely partnered with our local youth runaway shelter, and we have found, by the way, and we need to do a program on this, that the intersectionality between anti-trafficking work and working with youth, of course, who are on the street, or families that are having crisis, is really huge. So we're grateful to CCYS for all the work we're doing together with them. All right, that was a lot. Thank you for your patience on that. And I'd like to ask Katie to join us. Katie, if you'd like to come on and hi and share your
Hi,
screen, and
welcome.
let's get rolling. So for all of you who are therapists, this is going to be immediate information for those of you who are not. And what I'm looking forward to as someone who works with survivors is, how can we know how to make a good referral, right? And we'll talk about that. And Katie's going to let you know just how to make sure of that. So without any more from me, Katie, thank you for coming for part two. We treasure you and we're so grateful to you. And let's get rolling.
Robin, thank you so much for the accolades. I really appreciate it. So yeah, we did a part two. Well, the first time I presented was on trauma-informed care, specifically working with those who experience human trafficking. And I say that for a reason, using the word experience. Throughout this training, I might be using the word victim and survivor interchangeably. In my experience, victim is somebody who's currently experiencing human trafficking, and survivor is somebody who is recovering in the aftermath of their human trafficking experience. And then we have the thrivers and survivor leaders. And that is somebody who I consider myself. And throughout this training, also, I just want to mention that I'll be sharing some of my personal experience as a survivor of human trafficking, as well as sharing some of my professional and clinical experience. Obviously, not sharing any personal identifying information, but sharing some of my experience working with other victims and survivors of human trafficking. There will not be a lot of trigger information here, but in case you do get triggered, especially for those who might be survivors or family of survivors and victims currently, just know that there is help out there and that we do have different types of crisis hotlines in addition to having support as well. So please reach out if this does get triggering as well. So we're going to talk about trauma a lot. Again, I'll be talking about my own personal recovery as a therapist. The first thing to know about trauma is that everybody experiences trauma differently. My trauma started as a little girl, feeling neglected by my parents. This started wiring some of these internal belief systems and thoughts of, I'm not good enough. Nobody loves me. Why am I different? Why am I being treated this way? I started acting out at a very early age to gain attention and was in and out of the school's counselor office at age 5. It also didn't help that at that age, I had lost a sister at 3 days of age, and my mom went into a deep depression. I mention this because these same internal beliefs haunted me throughout, in and out of my life. These can honestly even creep up now. Today, when it comes to relationships, even with friends and family, and my significant other. And these internal belief systems, these are the things, some of these that kept me stuck in my trafficking experience that happened over 22 years ago. So I showed this slide in the last presentation, but I want you to just take a moment and look at it because I want to review this slide again. Because in my professional opinion, trauma symptoms and the diagnosis of post-traumatic stress disorder, PTSD, are one of the most underdiagnosed mental health conditions. Why? Because if you look at all these symptoms and behaviors, as indicated on this slide, we could find that individual all over the Diagnostic and Statistical Manual 5, the DSM-5. Some of the most commonly mistaken diagnosis for trauma is bipolar 1 and 2 disorder. Think about it. The hypervigilance, which means always on edge, easily startled, looking over your shoulders, lots of mistrust, easily jumpy related to small sounds, um, or somebody reaching out and touching them, coming up too close in the back. That's hypervigilance. Or the mood swings. And mood swings could be one day completely anxious, the next way deep depression. Or the deep depression could last for weeks. And then all of a sudden a panic attack happens. And irritability coupled with perhaps some chronic pain, some mood swings again. So if you look at here, nightmares, flashbacks, startle response, which is that hypervigilance, shame and self-hatred, intrusive memories, hopelessness, decreased concentration, insomnia, numbing, loss of interest. I could go on. But the thing is that these behaviors can be diagnosed in addition to trauma, but try not to overlook trauma as the essential component of why these behaviors and symptoms are happening in the first place. According to SAMHSA, Substance Abuse Mental Health Services Administration, individual trauma results from an event, a series of events, or a set of circumstances that is experienced by an individual as physically or emotionally harmful or life-threatening, and that has lasting adverse effects on the individual's functioning and mental, physical, social, emotional, and spiritual well-being. Trauma is any experience that overwhelms one's ability to cope. It's important to recognize the impact trauma may have on the individuals you work with because the goal is not to re-traumatize. And we'll talk about that just in a minute. Some other things related to trauma, and I might mention this again, but that's important, is that everybody experiences trauma differently. And something that I might go through one time as a traumatic experience may not affect you going through that same experience. In addition, it is known for research that somebody who may be, for example, in combat, in a car accident, in a natural disaster, in a fire, two people experiencing the exact same things. One person may have post-traumatic stress disorder symptoms or behaviors as indicated on this slide. The other person is okay. And that is the difference with trauma. It's a rewiring of the brain. It is using those fight, flight, freeze, and fawn responses. And that changes some brain chemistry, the amygdala, on these feelings of something's going to happen again. When it comes to survivors of human trafficking, we'll talk more, but they have consistent trauma where the individual is traumatized so much that they may not even realize that they're being traumatized. Does that make sense? They are in a constant fight or flight or freeze or fawn response that trauma healing and recovery can't take place until those situations are no longer a part of their lives. We call that chronic PTSD. Chronic PTSD. The other thing I want to mention too about trauma is that I might have gone through a traumatic experience. I did. So go through traumatic experience throughout my life. Sexually assaulted at a young age. That created one set of symptoms. Okay. That led to a lot of substance abuse in my life and eating disorders. A lot of misbehaviors, running away, homelessness, and then sexually overactive. Uh, then dating older boys. So we could talk about signs and symptoms of like something a lot of it, like how do I know if this person is going to be victimized as a human trafficking? How are they going to be exploited? Well, those symptoms, I did not meet any of the ACEs, adverse childhood experiences, those indicators. No, I didn't. But instead, I became exploitation to grooming to an older man. He wasn't that much older, but he was older. Um, 9 years. So when I was 18 years old. And that experience was one situation. Then the whole experience of of being in the life of the victim of being in sex trafficked, especially when I was told the threatening things, the coercion part that kept me stuck. Then years down the road, I'm in a horrible almost plane accident, flying from Key West to Fort Myers, and the plane got hit by lightning and dropped in the sky. That created a whole different set of PTSD symptoms, right? So we can have chronic PTSD after multiple traumatic uh, incidences that occur, right? And so the point is that one treatment may or may not abate, I guess, or treat the symptoms of PTSD. Instead, it might take multiple different types of treatment. And that is why it is so important for today's training in talking with different therapists and different individuals that they are cross-trained in multiple evidence-based practices. And that's why we're having this conversation today. Again, why are we having this conversation? Why should someone care? Well, a lot of it is, as we mentioned before, being trauma informed. The last training that I did, we went over very specific responses on how to be trauma informed, not only as an individual, but also as an agency or organization. If you don't have if you didn't have the ability to watch the previous training, please take the time. The resources are there. The checklists are in the PowerPoint. The information is there because a lot of people are like, yeah, we're trauma informed, right? Really? Are you? Do you know specifically what it takes to be trauma informed as an individual and as an organization? And it's not just a checklist, right? There's specific responses included in there. So I invite you to take a look at that as well. But there's a big difference between being trauma informed and a therapist who is trained in trauma, specifically evidence-based practices. Trauma informed care and trauma treatment are sometimes used interchangeably. If you take a look at this slide, it's kind of a diagram of the difference. Both provide care for people exposed to traumatic stress. However, trauma-specific services are clinical interventions, whereas trauma-informed care addresses organizational culture and practice. Trauma-specific services are clinical interventions that are designed to address trauma-related symptoms in post-traumatic stress disorder, PTSD. directly in individuals and in groups. It requires advanced counseling training, and many therapists are trained in evidence-based practices. So evidence-based means that there have gone through multiple studies, random control studies, that's RCTs, if you ever done some looking up research and whatnot. It has been through randomized control studies to show over and over again that this treatment works for the purpose of what it is intended for. So yeah, so many therapists, have that advanced counseling and evidence-based practices specifically for the treatment of PTSD. But in contrast, trauma-informed care is defined as a universal framework that requires changes to the practices, policies, and culture of an entire organization. So all staff, not just the therapists, all staff have the awareness, knowledge, and skills needed to support trauma survivors. It's incorporated key trauma principles into the organizational culture. So this matters because trauma-informed care is not treatment, but can confuse many because it implies treatment due to the word care. Using this term as a broad brush has the potential of misleading some clients into the understanding there is specific trauma treatment involved. So I wanted to kind of summarize some of these trauma-informed responses that I did talk about, though, just summarizing them. Because regardless of being a trained counselor or not, there are some essential trauma responses when working with victims and survivors of human trafficking. So some people be like, what do I need to do? What do I need to know? This is essential. Okay. Um, the next two slides, it lists trauma responses that are effective. This includes that survivors or victims have control in their situation. Are they able to take breaks when they're talking to you? Is there water available to them? Coffee, some snacks? How about the seating placement? Are they comfortable? As well as we have in the healthcare field, we talk about open door, shut door. Is the individual okay with the door being shut, or do they feel too much of a burden in that situation, too enclosed in? Having the whereabouts to be like, we're trusting that your privacy is important. This is all confidential, but are you comfortable with the door shut? Just having them have that choice, because trauma victims have lost the power of control and choice. And so again, lost the power of control and choice, trust, interpersonal relationships. That's what trauma affects, especially related to sexual assault and human trafficking victims, as well as intimate partner violence and domestic violence. You also want to be aware of the triggers to their personal safety. And that's what I was talking about as like open door, shut door, how close in proximity you are, not coming up on them unexpectedly behind them, asking if you're like a touchy-feely, huggy person, right? Asking permission, definitely asking permission, if that's even appropriate in the professional setting that you work in. You also want to be aware of your own judgment, perceptions, and attitudes, especially related to what is considered work, what is considered sex work. Looking at your own values related to sex work and knowing the difference between someone who is prostituting themselves and someone who is engaged in sex work versus somebody who is being sex trafficked, right? And the lines can be blurred sometimes, but the clear indication of somebody who is doing sex work and the difference between somebody who is being sex trafficked is all about control, agency, choice, and if they have control over their money. Any pimp and sex worker relationship is a form of human trafficking. Again, any pimp and sex worker relationship is a form of human trafficking. So having this judgment, perception, attitudes about values of sex work. And I'm just kind of talking about sex trafficking right now because that is more stigmatized in this nation, and about the ability to make choices. And in this situation, in a professional setting, those values can be close at home, but on the other hand, there are also professional boundaries. Like for me, I abide by the National Association of Social Work Code of Ethics. So we're thinking about code of ethics, and we're talking about and thinking about autonomy. Some other things is avoiding interrogation methods. Now, I know that there is law enforcement on this. I know there's some of the court systems, right? But even then, there are so many victims of human trafficking who are also have a record. I know that a statistic just came out, and it was something in the high 80s, that most individuals, specifically sex trafficking, have other types of criminal records. In the chat, what do you think those are? What kind of criminal records do you think those are?
Theft, theft, theft,
Theft.
drugs, drugs, drugs,
Yeah.
theft related
Yeah.
in drugs, assault, substance
Yeah.
abuse. I would add, yep, there we go. Battery, so some violent crimes.
And prostitution, you guys. You guys are missing one.
Well,
Prostitution. Yes,
loitering,
fraud,
child
prostitution, shop.
neglect, shoplifting, fraud hidden under other identities, Marchman Act, drug addiction, well, things related to drugs as criminal acts, DUI, all of the above. And
Drugs.
and
Yes.
really let's throw that word in, forced criminality, as a form of labor trafficking too, so people
Yes,
realized it's a technique of coercion
it
that
is.
traffickers use, right? Because then they can hold over, I'm turning you into the police because you did,
Hmm.
abused. Yep.
Yes. Yes, absolutely. So theft, drug involvement, and prostitution are the top three. Absolutely. So you guys hit it right on the nail. Yep, definitely. Yep,
Prostitution. Yep.
is the main. Yeah, thank you. Thank
Good.
you. And so those interrogation methods don't work. They don't. And most individuals, so there are some funding resources out there that mandate a person to admit that they are a victim of human trafficking. Other than that, the most individuals do not identify as a human trafficking victim. So you want to have more of a conversational approach with them with open-ended questions. So open-ended questions versus closed questions is closed-ended questions is yes, no. Um, what's your address? Blah, 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 right? Open-ended questions is more of a conversation. I am noticing this. Okay, you brought this scenario to me. You appear frightened with this individual in the room in next door to me. Can you tell me more about that? And then asking them, what do you know about human trafficking? Again, asking them, what do you know about human trafficking? And you say your opinion. I think what you might be experiencing is human trafficking. I just went through Katie Papke's training with staff, and I now think what you're experiencing is a form of human trafficking because you also want to maintain boundaries. How can you help them without the goal of rescuing? Rob and I are going to talk about this a little bit later. How can you help them without the goal of rescuing? You also want to follow through on any promise you make. If you tell them that you're going to get them a resource, then you need to follow up and get them that resource because that is how you start that rapport and trust. It's about resource brokering sometimes, which means being able to connect them to resources without giving them a dead end. Here, call this number, right? No, that does not work. How about a warm handoff? How about calling that community partner with them, that community resources? But also having the time to listen to them and being open and commending them. Oh, good. I was saying 80%. Yay, I was right.
Well, actually, that's me repeating you, Katie. So I'm trusting that you're right. But also, I just wanted to raise the point with what you said about the criminal involvement, that expungement and vacature are important, different but similar legal remedies for someone to take advantage of if and for us to facilitate if someone has committed these crimes while they're being trafficked.
Thank you so much. Another specific response when working with human trafficking victims as survivors is being aware of religious and cultural lens of their situation and being aware of the religious and cultural lens of your situation. That's where we were talking about values, going back to values and thinking, is sex work wrong? Am I here to judge them? Am I here to just automatically have these preconceived notions that they are criminals and drug addicts and that they are prostituting themselves for drugs? Is is that my first impression of this person? You hear that a lot. Oh, they're back again. Oh, they're here again. But my thought, and I always say this, is that it is important to look beyond your first impression. Missing the gaps, having the opportunities of not being able to identify this as a victim of human trafficking is so important. So important to capture that information. Also, survivors need to know that you're predictable. That's part of that trust, spreading a currency of trust. I mentioned that, doing warm handoffs with other individuals, even in your own organization. Like, for example, a SANE provider, right? Let's say you have your peer support or your community advocate, your victim advocate meeting with them. And you are then saying, well, we need to do this exam. Is it okay to do this exam with you if they have the ability to consent for that? And then saying, I'd like to introduce you to our nurse and doing that warm handoff instead of, all right, we're going to get you in next to the next appointment. It's just so important to have that safe space, to have them to have them continue to come back planting seeds of hope, right? Also, they don't want to have to tell their story over and over again. Warm handoffs with service providers and law enforcement is really helpful, especially as being a victim advocate. They need to hear you also verbalize difficult statements and having that calm, direct speech.
May I interrupt for a moment, Katie, because Paulette brought a really important point in the chat, which is they may perceive this as a safe space and they keep coming back. And it just reminds me of how that sometimes people leave, sometimes they come back, and how do you make sure that you have been a welcoming space, right?
Mm-hmm.
And to
Yeah,
expect that people might not continue with you as you start out.
that's right. That's why I said planting seeds of hope. Planting seeds of hope mean little things, little gestures, and always leaving the door open. So in this training, we'll focus on a phased approach to treatment. It can be difficult for survivors to recognize that they need therapy, and that's kind of more of what we're focusing on today. Survivors often have difficulty in trusting other people, particularly those who are in positions of authority, such as a therapist, a healthcare provider, and law enforcement. Often survivors operate in a survival mode to avoid thinking about their past or present situation, being numb, lots of dissociation, just often referenced as being a number. Just like other trauma survivors, many trafficking survivors may find it difficult to talk about their symptoms. The thought that talking about it means they are reliving it, that it's happening again. Nobody likes talking about or feeling uncomfortable feelings. That might happen, and that's where a trained trauma therapist also needs to have training in what we call grounding techniques. Grounding techniques, something simple as taking a deep breath, something as counting different objects in the naming different objects in the room. Where are your feet at today? Can you focus on me? You're staring out here. Can you focus back on me? Those are grounding techniques that you don't actually need to be a trained therapist to know, but trained therapists, trauma therapists need to be really cognizant of the dissociation and that might happen during a training session. Dissociation, there's different levels of dissociation. Sometimes I use words that I just assume everybody knows. So dissociation can be very mild, like you're driving down a road and you're like, oh my gosh, how did I get this far? That's dissociation. Or you're reading a book and all of a sudden you're in paragraph 4 and you don't even recall the last 3 paragraphs. And that's because your mind is somewhere else thinking about other things. And then there's a dissociation related to traumatic events. And this levels in different degrees. Okay. There is a dissociation with just wanting to feel numb. And sometimes drugs are induced by that. Sometimes different behaviors are induced like that by, like, for example, cutting, eating disorders, alcohol use, right? Just not wanting to feel anything, feeling numb. And then there is other degrees of dissociation where the individual wants to, or the individual has a feeling of floating or a detachment from their body. And then there is the most severe form of dissociation, which is called DID, dissociation identity disorder, used to be multi-personality disorders. DID, in my experience as a trauma therapist, results from extreme severe abuse, specifically more resulting in from childhood abuse. And it could be severe forms of physical torture or sexual abuse. So that's just my experience. Those are the different things of dissociation. Um, and then it can also be many years before survivors are able to talk about their past for them to be able to engage effectively in trauma-focused therapy, and sometimes they're ready right away. In my review of the evidence of phased approaches to trauma treatment, there are a lot of resources. Some are evidence-based, some are just written protocols or toolkits. What I took away are similar themes. All of them talk about trauma-informed care and how it is woven throughout each of these phases. So a couple years ago, worked with Dr. Celia Williamson. She is another podcast connoisseur. She works for Emancipation Nation, did a couple podcasts with her, and created a training manual for therapists for trauma treatment. And I took her original thought processes of different trainings, different skills learned, and kind of made my own. Um, and so in phase one, it focuses on safety and stability of where the individual views themselves as a victim. In phase two, these are learning skills. Individuals start identify as being a survivor and then focusing on their recovery process. Processing trauma and long-term support, we called the individual a thriver in phase three. And I'll break these down here next. So it is my experience that it is essential to start with safety and stability. And so a lot of individuals that I see, they are different phases. And in this phase, individuals, they're definitely still in survivor mode. Their safety and well-being depend on the ability and the education of organizations to screen, assess, and identify them in a system that often constructs a lot of barriers to care. Uh, phase one work should be measured in skills, not in time. So somebody who comes and sees you could be, or someone you have interactions with could be in phase one for a long time. And indeed, some clients, they may not even move beyond phase one. And this is not a therapeutic failure. They may lack the resources internally and externally to engage in trauma processing work, but they can still move from a dangerous situation. This three-phase approach also makes it clear that even short-term work with a complex trauma client can be productive. Again, only even short-term work. So we just talked about that. They're coming to the service, the organization, you're planting that seed, you're offering something they don't even want that therapy services. They don't want to leave their trafficking situation even. But you're there and you have the door open and you're providing that immediate resource that they came in for the first place. And this could be either a warm spot to sit, it could be a safe place to stay for the night, it could be somebody just to talk to for a hot minute, it could be food, and it could be in an emergency room or an urgent care center. But what that does is it provides an immediate short-term gain and can establish a foundation for the possibility of more long-term trauma-focused work in the future. For people who are having a mental health crisis and need intensive care and treatment, acute mental health services such as inpatient should be offered, or perhaps they might need stabilization in a detox unit or residential substance abuse treatment program. So the focus of these services in phase one it is about management and reduction of risk, together with stabilization of acute problems such as in their kind of psychotic symptoms, withdrawal from substances, or severe depression and suicidality. These services are generally only offered for as long as they are needed. Okay, so this phase one safety and stabilization, they're usually just offered as long as they are needed. Substance abuse, it has a very complex relationship with human trafficking. Some victims, they may feel powerless, stemming from the misperception that their incidents or series of incidents of what they're being involved in are somehow their fault because of their use of substances. Like, for example, debt bondage. Having one of my clients, they were always saying, well, I can't leave because otherwise they will kill me because I continue to owe them for what I'm using. And what she was using was crack cocaine. Um, Again, they feel like it's their fault. Um, a broader survey of US survivors of sex trafficking found that 84.3% use substances during their trafficking exploitation. 84.3. Alcohol, marijuana, and cocaine were used by more than 50%, and nearly a quarter used opiates and specifically heroin. In my situation, I had previously gotten sober. I got sober at age 17. And when I moved down to South Florida, specifically in Fort Myers, Florida, I um, I was I was trying to be in the recovery community. And that's actually where, unfortunately, I met my trafficker. Not in the rooms of AA, but I had made friends with somebody in AA meetings and had when they relapsed, I met my trafficker. And that person, I had no idea what was going on in in behind the scenes. But he groomed me. He told me, "You're so beautiful. Why are you having sex with men for free or boys for free?" He would tell me. Instead, you don't have to have sex with them at all. I'm gonna teach you how to rob them and steal from them. And you just have to do the bare minimum. And I believed it. And he thought of himself as my boyfriend. I didn't think of him as my boyfriend necessarily, but more than like a protected friend. It wasn't until he introduced me to an escort system, then I was stuck because that's when the threats came. And so I did all of my experience was start cold sober. And they wanted me to stay sober. Why? Because sober, healthy, young adult in my situation was worth more than somebody who was addicted to alcohol, marijuana, cocaine, or heroin. Just another example is that there's one woman that I worked with who it was a sex trafficking situation, but her trafficker, who she also had viewed herself as a relationship with, was selling drugs, and he had to have her go and deliver the drugs. So he had a number of charges against her for not only prostitution, but also possession and distribution of narcotics, all in the context of labor trafficking. Robin,
Um,
you can say something?
yeah, Heidi brought up a great point, noting that a lot of traffickers seek out people with vulnerabilities and withhold substances to cause withdrawals and to induce compliance, essentially.
Yes, that is absolutely correct. It's also used as a coping mechanism for their experience and again, staying numb in their coping mechanism. Also, some traffickers recruit directly from use disorder treatment facilities and different um, uh, shelters or day centers as well. So I think of the next phase, phase two, as skill building. In this phase, individuals view themselves as survivors, but they still might be acting in survival mode because they might be reluctant to fall asleep because of nightmares, relive the traumas over and over through flashbacks, have intrusive and negative thoughts that are overwhelming to them. Uh, Shame, guilt, and fear overwhelm them. They also might keep them stuck in their trafficking situation in the first place or going back to their trafficking situation. Shame, guilt, and fear. They have distrust of everyone, but they may be open to start processing their traumas. This phase is about reconnecting with past supports, if they're healthy and reliable, and connecting with new supports that offer hope and empowerment to walk through their trauma. Again, new supports about reconnecting and connecting and offering hope and empowerment. This work can be used as a combination of evidence-based therapies and other complementary supported strategies for improving and maintaining trauma symptoms. Evidence-based practices in this phase include seeking safety, skills training in affective and interpersonal regulation called STARE, strengths-based trauma-informed approaches, present-centered therapy, or mindfulness-based stress reduction. I have used all of these evidence-based practices in my training, as well as assessing for referrals to ongoing treatment needs. Like they might enter in this phase, but then all of a sudden they might not, they might need a different form of treatment, like a residential treatment. Um, Being trained in a combination of these practices allows you to tailor the treatment to meet the client's needs in this phase. These skills or tools can help overcome negative beliefs and create a place of internal safety and challenge core harmful beliefs. These skills can help identify who is trustworthy and to start trusting their own decision making. Again, these are all in phase two about skill building. The ability to become vulnerable and build healthy relationships and identify unhealthy relationships to start creating boundaries and self-care, right? So these are all skills to learn. Again, become vulnerable and trust their own decision making, build healthy relationships, identify unhealthy relationships, create boundaries, and self-care. There can be ongoing triggers for automatic thoughts as well. These are the links at the end of the present, or there are links at the end of this presentation on how to access additional information and training for these evidence-based practices.
And Katie,
Robin?
I'm getting a few notes in the chat, and I would like to reiterate that I just posted the Stack website so you can see these resources. The PowerPoint will be there so you can have all the hyperlinks as we go forward. So don't worry about, just furiously taking notes because all of this information will be there for you. Also, I want to, before we get further down the road on this, Katie, you mentioned Dr. Williamson's a manual or something about a manual that she created and that you worked together on, and then you created something yourself. Is there a link, or can we share with people how they can get a hold of that manual? I shared the link to her podcast, by the way. So, but I can't find the manual.
No, that's fine. Uh I will it's in my I think it's in my last slide where it has my contact information
Okay,
and Emancipation Nation, and it will say become a member. Membership is free. And then that's how you access the training materials.
perfect. Thank
So
you.
yeah, absolutely. In my situation, these automatic thought processes, remember I mentioned those initial thought processes is what's wrong with me? Um, what is, why am I different? Why am I being treated this way? Nobody loves me. Those thoughts ran rampant for the first few years after leaving my trafficking situation. Also, throughout the years, different events would trigger these same thoughts. For me, their worst was during my divorce 3 years ago, and I instantly had to get back into therapy, and that's okay to do so. But I knew that therapy worked, and I restarted eye movement desensitization reprocessing therapy, EMDR, which we'll talk about later. In phase two interventions for my clients, I am assessing constantly for these themes of automatic thoughts. In phase three of processing the trauma experiences, I'll continue processing these automatic thoughts and discuss how during different life circumstances, these triggers can happen at any time. But the most important thing to know is that in phase two, they have built the essential skills and tools to assist in challenging these thoughts. And sometimes those life experiences are what bring clients in to seek trauma services and treatment. In my experience, I had been reached out by a lady who was trafficked 50 years prior, and she had a life circumstance that it was unfortunately, it was being financially exploited. And this just brought back all of everything she tried to repress as a young kid. And when we did trauma treatment, her mental health symptoms actually regressed. They got worse for a little while. And so I couldn't start with phase three. I had to go back to phase two in skill building to talk to them more about different things, specifically doing what we call present-centered therapy. And there are other links again in the chat: seeking safety, STARE, present-centered therapy, mindfulness-based stress reduction. Again, these links are at the end. But I want to do a little focus on present-centered therapy. This is a time-limited treatment for PTSD that focuses on increasing adaptive responses to current life stressors. Adaptive responses. So how like skills over time, right? And the ability to talk about what happened, if that is their goal. Um, and again, the life stressors directly that are or I'm sorry, that are directly or indirectly related to their trauma or PTSD symptoms. It is recommended as a second line treatment for PTSD following phase one safety and stabilization from the International Society for Traumatic Stress Studies and the VA Department of Defense 2023 Community of Practice Guidelines, which I actually contributed to. PCT, present-centered therapy, can be completed in a group setting or individually. And the reason I'm focusing on present-centered therapy during this phase, specific for human trafficking survivors, is it because it is very narrative in essence. After the initial assessment phase, PCT is not about specifically talking about their trauma. It's designed to focus on current life to help get a clearer picture and better understanding of problems and stressors and increase their confidence and ability to deal with those problems. It's also be able to feel more in control of your life again, feel more connected to others, experience less distress. And I feel in phase two of treatment, this is exactly where the conversation and therapy needs to be focused on with survivors of human trafficking. Again, they're getting a bit clearer picture and better understanding of their problems, their confidence, how to deal with problems, feel more in control of their life again, feel more connected to others, experience less distress. That's where, in this phase, survivors need to be. Amy wrote, I've met a young lady who has 4 kids and she shows a lot of signs of a victim. How would I get to see that without traumatizing her? How would I get her? So I would mention an open-ended question. Robin, you just said, let's talk about that at the end, but hey, let's talk about it right now, right?
Absolutely, absolutely. I didn't want it. You were in such a nice flow there, but thank you for popping off and popping back on here. Yes.
No, that's okay. So what I do in that situation is I identify what signs that I'm noticing. And I ask, and I'm saying that in a very like um I'm noticing, for example, that it appears you're being taken advantage of, or it appears that you're very fearful of, or it appears, whatever the sign is that you're talking about, or you're acknowledging it. And then you say, can you tell me more about this? Like you're listening to their story. And then the point is, though, is to circle back to say, this, I just went through this training, or you can say, I've been trained in human trafficking, specifically like sex trafficking, specifically labor trafficking. What do you know about that? What do you know about sex trafficking? And you're eliciting their responses. So then they have the ability to say, no, I don't know anything, or are you sure? And you're able to right then and there address any kind of preconceived notions or myths that they have about human trafficking. You can share with them the definition of human trafficking. This is not a human trafficking 101 training, by the way. But you can talk to them about exploitation. You're concerned about, exploitation. And then tell them, it crosses the line from exploitation to human trafficking when force, fraud, or coercion is involved. And you can speak to the specific sign of each of those. So, for example, I feel like you can even use the word, I feel like you're being fraudulently told one thing, but it appears that this is really happening. So, you're using the definition of what it means with human trafficking. Again, force, fraud, or coercion has to be present. And instead of saying the things with their exploitation, I hope that explains. But the bottom line is you're bringing up that conversation, you're having that hard clinical or professional discussion with them about about the signs that you're seeing. Um, Flash technique. Is anybody trained in the flash technique? Feel free to put your answers in the response. Anybody trained in the flash technique?
And while they're answering, Katie, and you take a sip, I just really appreciate you walking through these techniques because even if you're not a therapist, for an advocate to know that these are available and out there and to ask, the therapeutic community where they live, does anybody know about the flash technique or person-centered therapy? So thank you for all this. I'm really loving this. And no one is familiar that is answered so far. We got
I
no,
know, I can see that.
yeah, yeah.
Um, Yeah, so the flash technique um, actually doesn't have to be by a trained therapist. So our advocates, our peer supports, other professionals that work directly with clients, pay attention. The flash technique is actually recently developed an evidence-based therapeutic intervention founded in 2017 by Dr. Philip Manfield for reducing the disturbance associated with traumatic or other distressing memories. It can be used in groups or with individual clients. And unlike many conventional therapy, trauma therapy interventions, the flash technique is a minimally intrusive option that doesn't require the client to consciously engage with the traumatic memory. So that's why I have it in phase 2. It relies on the brain's working memory to process traumatic events and images without having to verbally process the traumatic situation. And this allows the client then to process traumatic memories with minimum or no feelings of distress. This is important because sometimes verbally processing the traumatic event can be re-triggering and heighten the body's trauma response. In phase 2 of the skill building phase, the flash technique can make it possible to process memories that would otherwise be intolerable or overwhelming to the client due to feelings of anxiety, panic, dissociation, extreme anger, and others, for example. Instead, with the flash technique, it helps the individuals remain calm and facilitates brief look backs. Again, brief look backs on the traumatic memory while maintaining a positive, engaging focus throughout the session. It can also bring down the emotional disturbance very quickly if needed. So the flash technique was actually originally developed as an addition to the preparation phases of EMDR, eye movement desensitization and reprocessing. But like EMDR, the flash technique utilizes eye movements or alternative tapping and is designed to resolve unprocessed traumatic memories in the brain. So we might have seen this, right? Going back and forth. My hands, my fingers, for those who can't see me, are going back and forth and illustrating rapid eye movement. The same technique can be used with light bars and tacks that I use in my trauma treatment through EMDR. Another form of a flash technique can be tapping on a surface, or what I use with human trafficking survivors is the butterfly tapping back and forth. And I'm mirroring this. So this is one part of it. And a principle, though, with the flash technique is that unresolved traumatic memories are responsible for most non-organic symptoms. And it's kind of used as the goal of the intervention is to really painlessly reduce the disturbance, those unwanted symptoms, with a targeted memory, and to level that with that client that no longer resistant to fully accessing the memory so they can process it later on. I've used the flash technique as a standalone intervention. I've used it with EMDR in different phases of treatment. I have also incorporated it in cognitive behavioral therapy, cognitive processing therapy in a way to reduce exposure-related disturbances. Um, so more additional information, examples of the flash technique between myself and a client, as well as a detailed modified script for use of the treatment with human trafficking survivors, again, can be named in that, or can be found in that Emancipation Nation Network website mentioned previously. I also want to just mention the really, really important things of complementary and integrative health options such as yoga, hot yoga, trauma-informed yoga, equine therapy, expressive arts, acupuncture. These are all things that I use um, throughout my self-care and taking care of myself, and highly recommend it. Especially another thing that I do, I was told by a long time ago by a therapist that I needed to learn healthy touch. And so she recommended to me to go get massages. And that massages was so important as part of my healing. And some people can't handle hot yoga. I love hot yoga because we're all just trying to survive, and I can cry in there, do some hip releases if needed, and nobody cares because they're all trying to survive too. Um, hot yoga is Bikram yoga. It's basically yoga in a sauna. Um, so I want to move on to phase three here. The unfortunately, are what I feel like are the gold star treatments for those experiencing human trafficking is EMDR and cognitive processing therapy, not cognitive behavioral therapy. Again, EMDR and cognitive processing therapy. Unfortunately, these recommendations are based largely on research in other groups of traumatized patients, reflecting the lack of a lot of evidence-based specific mental health treatments for human trafficking victims. Um, so what that means is that a lot of these are based on sexual abuse, domestic violence, or torture survivors, informed by an understanding of the psychological issues faced by human trafficking victims. If you have not received formal training in these therapies, I've provided links at the end of this module of how to obtain these trainings. And in my experience, if you are a trauma therapist, I highly recommend being trained in EMDR. I personally and professionally can speak to it. I think it is the most effective trauma treatment. It's just that most people, or a lot of clients aren't ready for EMDR, and so that we need to slow down and work more on what we call the resourcing phase, which gets them the skill building phase. That's why there is a phased approach here, specifically working with human trafficking victims and survivors. Um, I cannot speak enough about the support of peers of human trafficking survivors. In this digital day and age, in-person support groups are hard to find, but there are many organizations and Facebook groups that help overcome that digital divide. People need to know that they are not alone, that there are ongoing triggers, internal thoughts that can keep us stuck, and shame and grief that can take years of healing. Having a supportive recovery system of those who can personally identify with each of them, in my opinion, essentially is so important. And I really want to focus on trafficking survivor-led peer support. In my experience, it has been noted to be a vital component of intervention, both as a motivating factor to remain in treatment and as help in the prevention of survivors returning to their traffickers. Furthermore, discussing stigmatizing topics within group settings can help reduce shame, as it is common for traffic survivors to feel that no one else has gone through similar situations. And having a setting to address that shame can help survivors recognize the commonality of their experiences and build support. Robin, you want to come on?
Yes, yes, yes. Hey, so as we go to the next step, let's get a couple questions in, and if I could just add, somebody asked on your what you just were talking about is, would hypnosis work as a therapy, or would that bring up more trauma for people who have been involved in trafficking?
Say that again.
Would hypnosis be one of these therapies that you could use, or would that bring up kind of cause more harm than good if dealing with someone who's been trafficked?
You know what? I cannot speak about the evidence behind hypnosis and trafficking. I can only speak to the evidence-based practices that I've done research on, and like, so for example, flash technique and EMDR have, the eye movement part of it, but that is related to processing memories that are stuck and using that in the amygdala and be able to process those traumatic experiences as if they're not being reliving it. So if there is research or literature out there related to hypnosis, I would be interested to hear that as well.
Okay, great. So we've got a possible resource out there. So thank you. So everybody, we're going to have a little conversation here, but know that there's a whole other chunk of slides that we're going to get through. But Katie, I wanted to take a moment and just ask you a couple of things that have come up as we've been talking, which is, so just personally for you, how do you continue to do this work when you are working with people who have been maybe going through something similar to what you have? How do you stay healthy and strong? And what are some of your kind of coping mechanisms? And I know you've talked about a few of them, but how do you continue on?
Yeah, thanks, Robin. So for me, um, I was already, while I was being trafficked, I was already in school for human services. I actually went to a small school called Florida Gulf Coast University in Fort Myers, Florida. Um, I heard it's bigger now. I haven't been there since 2003, so I don't know. And then I transferred up to Florida State University a while back after I got out of my trafficking situation. And I wanted to be a social worker. Um, at that time, I had no idea what human trafficking was, no idea. As a matter of fact, I thought I was a sex addict. Um, and I remember it was about 13 years ago when I was sitting in a human trafficking training, just like this, continuing education training. And I literally, not to be dramatic, but I fell out of my seat. I was on the edge of my seat because I could relate to every single thing that person said. And I said, and I was always looking for answers. I always felt the shame. And I was already trained in therapy and but never realized what had happened to me had a name. And so then when I was able to name what happened to me, the walls of shame just started washing away. And then I went through EMDR treatment myself and I said, oh my gosh, I wish I was introduced this so many years prior, so many wasted, I feel like hours of my life in and out of other psychological treatment. And and I decided to, have my own private practice then to do EMDR and to train others on human trafficking and then working with the survivors. So I came from a very empowerment where I found this is my niche. I wanted to help others because when I sought help, I was told that somebody would pray for me. And that is not what I needed at the time. I needed a support group. I did. I needed a support group and I needed somebody to recognize what was happening to me was human trafficking. None of the therapists that I went to noticed that. They did
And
not.
that is so powerful. And thank you so much for sharing, as well as you've shared so much about your own journey here, because you really, I think, have touched a place of empathy and compassion for people to realize that, you know, we are all connected with the very, very human reactions that you had, the very, very understandable reactions you have. And also, I want to kind of focus back on, you use the word empowerment, and I always think of the word empowerment sometimes by referring to its opposite, which is this kind of rescue thing that can happen when you're dealing in these situations. Maybe you're a therapist, or maybe you're an advocate, or maybe you're a family member of somebody, and you really want to. People often say rescue, and we try to talk about how, hey, it's not about rescue, right? It's about walking with, it's about empowering that survivor.
I know there was Lisa just said, I'm a survivor. Where can I find support groups? So there's Facebook groups. Also, I I have a resource too, um, through um, it's our Three Strands Global Foundation Survivor Advisory Board. Um, there's resources out there related to to Survivor. And I'm trying to think here, right here. There's Facebook groups, right? Specific groups just for survivors. Um, and they are very helpful related to connection. And there, yeah, there is actually support groups out there that they're online, right? Um, no, those Facebook groups are private. Um, they are. There's like definitely you can tell the difference. But no, these ones are private. Um,
Mhm, mhm.
yeah, and we're not giving personal information. We're asking about support groups, and so then the support groups information is shared privately. So,
Yes, and I know that restoring Ivy has also been one, and I can put that back in there. But just going back for a second, I know that you, thank you for that, and I'll put in a link to restoring Ivy. The other part of this idea, and I know you're going to talk on it, I think, is about not having this rescue mentality. If you are a therapist and you're working with somebody, or you're a friend or an advocate, right?
yeah, say that again, Robin. I'm sorry. I just
I,
totally just was looking at the support group right online that I'm looking at, and then I blanked what you said. I totally
That's
apologize.
okay. It's what we talked about before, is the kind of problematic nature of being in a rescue mentality. How it's easy to get into that if you're working with somebody, if you're an advocate or a therapist or a friend, you really do have this kind of urge to quote rescue, but that's not what it's about, is it? You said empowerment when you were talking about your own story. So I just wanted you to maybe reflect on that for a moment. Maybe give people some some thoughts about it when that very natural reaction can emerge from you.
Yeah, I think so too. I come I usually with individuals who are consenting adults. Anybody under the age of 18, it is automatic child abuse, right? But with consenting adults, is my experience is that I would treat that individual the same way I would treat them in an intimate partner or domestic violence relationship, where you are planting those seeds of hope. You're giving them resources. You're talking about safety planning if their desire to leave, but you cannot take them home with you, right? Um, we also want to we be careful with contacting law enforcement unless one, you feel like they are in immediate danger and need that law enforcement, or two, they're consenting to being having law enforcement involved. And that's why also um, making calls, for example, to the hotline, the National Human Trafficking Hotline, 888-373-7888, with them can be helpful. You don't have to report their information. Instead, look for resources and connections for them through that hotline number. Um, Giving them resources, planting those seeds of hope, Those are the things so they can make the decision to leave their trafficking situation if they want to. If they want to be helped, then that opens up a whole nother door to resource brokering for them, making those connections and warm handoffs in the community. Going back to some personal reflections, I look back at my trafficking experience and think, wow, I was such a different person back then, in a different mindset, so much dark energy and anger. It's just sad. It's almost as if I was living a double life. I was living a lie of wanting revenge on the opposite sex. This acknowledgement allowed me to forgive myself and really release the shame that bound me. I found my voice because I found out the difference between prostituting myself and being sex trafficked. There were others like me, and what happened to me was beyond my control, beyond my choice. I had lost the ability to have that power and control once the traffickers became involved. I also found I wanted to help others and started working as a private practice therapist, providing trauma treatment to those who have experienced human trafficking. Again, a change in mindset. I forgave myself and I wanted to help others. I leave you with some quotes. They may leave the life, and that's specifically talking about sex work, if they see hope in their future, and you can be a part of their future. I also say resilience is very different than being numb. Resilience means you experience, you feel, you fail, you hurt, you fall, but you keep going. Uh, I just want to do a plug-in for stack training education resources. There's also my podcast link in there, which I know Robin did the link already. Here's my contact information. I appreciate everybody's time. Uh, the um, the course, I do have that course information too. But it's called Advanced Mental Health Trauma Therapy for Clinical Professionals, and it is a course through the Emancipation Nation Network. Thank you so much. Appreciate it.
Oh, this is great. Thank you, Katie. Once more, the hearts and the gratitude is runneth over to you and the great information that you provided today. I learned a lot as always from you. Thank you so much. And I'd like to, we've got a couple of minutes to quickly go through some things. One, somebody asked, you recommend calling the Florida trafficking hotline even if you did not get consent first? Is that like calling the national HT hotline, or is it calling law enforcement? Thank you, Mary Rose, for asking. That is calling law enforcement. That line goes directly to FDLE, and FDLE then calls your local law enforcement. So you absolutely need to get permission and to path out to the survivor that that's going to trigger more if you reach out to law enforcement, just like what Katie said. The National Human Trafficking Hotline will connect you to law enforcement if you're a minor who's in danger. And also if you say, I want to be connected to law enforcement and you're a survivor or you're calling. So that's a different thing. The national hotline will connect you to services, which is kind of a difference with the Florida hotline. So thank you for all this. And 58 messages have come in. Many thank yous. So I am streaming through. Do you see any other questions?
Mhm.
Um, are you seeing patients out of state? Someone is asking, Katie.
Yes, I do. Yeah.
I would love to refer to you, a physician in Boston. Katie's information is right there, right?
Hmm.
Okay, perfect, perfect. I mentioned to Katie too, everybody, I think this issue of trauma is one, and we mentioned it before, but this is so foundational and so important. I think that everybody has experienced trauma. And the piece that I take away from this, we always do takeaways, is that again, um, the importance of empathy, of us understanding. Some people say, but for the grace of God go I, or just the idea that we are all connected and that having compassion for ourselves and for one another and connecting us to survivor's experience is just foundational and fundamental. So thank you very, very much for all you've done to help us along this road again, Katie.
Thank you. Take care, Robin, and thank you so much to Stack and everybody for having me. Take care.
Thanks, everybody. And thanks to USF. Bye bye.